If you are over 60 and still trying to force your blood pressure down to exactly 120/80, this message could change the way you think about your health forever. For decades, people were told that 120/80 is the perfect blood pressure. Doctors repeated it, health websites promoted it, millions of older adults became obsessed with reaching that number at any cost. But today, many cardiologists are starting to warn that aggressively chasing 120/80 after 60 may not always be the safest strategy, and for some people, it can actually create new health problems instead of preventing them. Imagine standing up from your chair and suddenly feeling dizzy. Imagine waking up exhausted even though your blood pressure looks perfect on paper. Imagine falling in the bathroom because your body isn't getting enough blood flow to your brain fast enough. These situations are becoming more common, especially among older adults taking multiple blood pressure medications just to hit a target that may no longer fit their age, body, or overall health condition. What's even more surprising is that many heart specialists now focus less on achieving one magical number and more on finding a safer, more stable range that protects the heart without starving the brain, kidneys, and muscles of healthy circulation. In other words, the goal is no longer perfection, the goal is protection. And here's the scary part. Many older adults don't even realize their blood pressure may already be too low for their body. They assume lower always means better. But new research and clinical experience are showing that extremely aggressive blood pressure control in seniors can sometimes increase the risk of falls, confusion, weakness, fainting, and reduced quality of life. In this speech, you'll discover why the old rules are changing, what numbers many cardiologists now consider safer after 60, the symptoms that may signal your blood pressure is being overcorrected, and how to protect your heart without putting the rest of your body at risk. Because the healthiest blood pressure after 60 may not be the lowest number, it may be the smartest one. For years, people over 60 have been told that 120/80 is the gold standard for blood pressure, almost like a universal rule everyone should follow no matter their age or physical condition. Many older adults became extremely focused on reaching that number because they believed anything higher automatically meant danger. But modern cardiology is beginning to challenge that thinking. The reality is that aging changes the body in ways that make blood pressure management far more complex than simply pushing numbers lower and lower. As we grow older, our arteries naturally become stiffer, blood vessels lose some elasticity, and the body may require slightly higher pressure to maintain proper blood flow to essential organs like the brain and kidneys. When blood pressure is forced too low through aggressive treatment, some seniors begin, for example, experiencing symptoms they never expected to be connected to their medications. They may feel dizzy when standing up, unusually tired during the day, mentally foggy, weak while walking, or unstable on their feet. In some cases, older adults suffer dangerous falls because their blood pressure drops too quickly when changing position. What looks perfect on a chart may actually feel terrible in real life. Many cardiologists now emphasize that blood pressure targets after 60 should be individualized rather than treated as a one-size-fits-all formula. A healthy, active 62-year-old may tolerate lower blood pressure very well, while an 80-year-old with frailty, diabetes, kidney disease, or balance problems may actually be safer with a slightly higher reading. Some specialists now believe that maintaining systolic pressure somewhere around the 130s can provide a better balance between protecting the heart and preserving stable circulation throughout the body. The goal is to reduce the risk of stroke and heart attack without causing weakness, fainting, or reduced blood flow to critical organs. This shift in thinking is especially important because many seniors are taking multiple medications that interact with one another, sometimes lowering blood pressure more than intended. The body may not always adapt smoothly to these changes, especially during dehydration, illness, hot weather, or poor nutrition. What matters most is not chasing a perfect number, but finding a safe and sustainable range where the person feels energetic, steady, mentally alert, and physically capable while still protecting long-term cardiovascular health and overall quality of life. One of the biggest changes happening in modern heart care is the growing realization that older adults may benefit more from a safer blood pressure range rather than an aggressively low target. For many years, 120/80 was promoted as the ideal number for nearly everyone, and millions of people over 60 believe they had ailed if their readings stayed above that level. But many cardiologists today are becoming more cautious about pushing seniors toward extremely low numbers, especially when those numbers come with side effects that reduce daily functioning and overall quality of life. Instead of focusing on perfection, specialists are increasingly focused on stability, safety, and how the patient actually feels in everyday life. For many healthy adults over 60, cardiologists now often consider a systolic blood pressure somewhere in the range of 130 to 139 to be both reasonable and safer, particularly when the person is functioning well without dizziness, confusion, or weakness. This does not mean high blood pressure should be ignored or left untreated. Elevated pressure still increases the risk of stroke, heart disease, kidney damage, and vascular problems over time. However, the newer approach recognizes that the body changes with age, and those changes affect how blood pressure should be managed. Ole. The arteries are naturally stiffer, and the circulatory system may require slightly higher pressure to deliver blood efficiently to the brain and other vital organs. If blood pressure is lowered too aggressively, some seniors may experience poor circulation symptoms even though their readings appear excellent on paper. This is why many cardiologists now pay close attention to symptoms rather than relying only on numbers. A patient whose blood pressure reads 118 over 70 but constantly feels exhausted, lightheaded, or unstable may actually be overtreated. Meanwhile, another patient with readings around 135 over 80 who feels energetic, mentally sharp, and physically stable may be in a healthier situation overall. Doctors are increasingly asking questions about balance, memory, walking ability, fatigue, falls, hydration, and medication side effects before deciding how low blood pressure should go. Another important factor is that many older adults are taking several medications at once. Blood pressure pills combined with diabetes medications, sleep aids, heart medicines, or dehydration can sometimes create sudden drops in pressure that become dangerous. This is especially common during illness, hot weather, or after standing up too quickly. The safer number is not simply the lowest number possible. The safer number is the one that protects the heart while still allowing the brain, muscles, kidneys, and entire body to function properly every single day without unnecessary risk or physical decline. One of the most overlooked dangers after 60 is the belief that lower blood pressure is always better. While high blood pressure absolutely increases the risk of heart attacks and strokes, blood pressure that becomes too low can create an entirely different set of health problems that many older adults never see coming. In fact, some seniors spend years trying to push their numbers down as far as possible without realizing that overcorrecting blood pressure may quietly reduce circulation to some of the body's most important organs. The result is that people can appear healthy on paper while physically feeling weaker, more exhausted, and less stable in everyday life. The brain is often one of the first organs affected when blood pressure drops too low. Older adults may begin experiencing dizziness, mental fog, slower thinking, blurry vision, or difficulty concentrating. Some notice they feel unsteady when getting out of bed or standing from a chair. Others feel unusually tired throughout the day, even after resting. These symptoms are sometimes dismissed as normal aging, but in many cases, they are actually warning signs that the body is not receiving enough consistent blood flow. When circulation drops suddenly, the risk of fainting and falls increases dramatically, and falls after 60 can lead to fractures, hospitalizations, loss of independence, and long recovery periods. The kidneys are also highly sensitive to overly aggressive blood pressure treatment. These organs depend on steady circulation to filter waste and maintain fluid balance. If blood pressure falls too low for too long, kidney function can slowly worsen over time, especially in older adults who already have diabetes or mild kidney disease. Muscles can suffer as well. Some people notice weakness while walking, reduced stamina, or fatigue during simple daily activities because oxygen and nutrients are not reaching tissues as effectively as before. Another major problem is that many older adults take several medications together, and the combined effects can unexpectedly lower blood pressure far beyond what was intended. Dehydration, skipped meals, hot weather, illness, or standing up quickly can make these drops even more severe. This condition, often called orthostatic hypotension, becomes increasingly common with age and can turn ordinary movements into dangerous situations. A person may feel fine sitting down but suddenly become lightheaded the moment they stand. Modern cardiology is beginning to recognize that blood pressure treatment should not only prevent future disease but also preserve daily function, mental clarity, balance, and independence. A reading that looks ideal on a medical chart means very little if the patient feels weak, confused, unstable, or constantly fatigued, because true cardiovascular health is not only about surviving longer but also about living safely, confidently, and comfortably every single day. One of the biggest reasons blood pressure guidelines are changing for older adults is because doctors now understand that aging affects every person differently. Two people can both be over 60 and have completely different health needs, energy levels, circulation patterns, and medication responses. That is why many cardiologists no longer believe in treating every older adult with the exact same blood pressure target. Instead, they look at the whole person, not just the numbers on a monitor. Age, frailty, physical activity, balance, memory, kidney function, heart health, and even daily lifestyle habits now play a major role in deciding what blood pressure range is actually safest. A healthy and active 65-year-old who exercises regularly, eats well, and has strong muscle tone may tolerate lower blood pressure without any problems. Their body can often adjust quickly to circulation changes, and they may feel perfectly fine with readings close to 120/80. But an older adult who is frail, underweight, recovering from illness, or taking multiple medications may react very differently. For them, aggressively lowering blood pressure can increase weakness, dizziness, confusion, fatigue, and the risk of dangerous falls. This is why modern cardiology is shifting away from a one-size-fits-all approach and moving toward individualized care that focuses on function and quality of life. Frailty is especially important because it changes how the body responds to reduced blood flow. Older adults with muscle loss, lower reflexes, poor appetite, or balance issues may not tolerate low pressure well. Even a small drop in circulation can make them feel exhausted or unstable. Doctors are now paying closer attention to whether patients can walk comfortably, think clearly, stay independent, and perform daily activities safely, rather than simply chasing the lowest possible reading. In many cases, maintaining stable and moderate blood pressure is safer than constantly adjusting medications to reach a strict target. Lifestyle also matters more than many people realize. Hydration, sleep quality, stress, diet, physical activity, and even how quickly someone stands up from bed can influence blood pressure throughout the day. Some older adults experience dramatic pressure swings because of dehydration or medication timing, while others remain stable naturally through healthy habits and regular movement. Cardiologists now recognize that the same blood pressure reading may be completely safe for one person and problematic for another depending on their overall condition. This more personalized approach represents a major shift in heart care because it focuses not only on preventing disease years from now, but also on protecting strength, independence, mental clarity, mobility, and daily comfort in the present, which ultimately matters just as much as the numbers written in a medical chart. Many older adults never realize their blood pressure may be too low because the warning signs often appear slowly and are mistaken for normal aging. People assume fatigue is simply part of getting older, or they blame stress, poor sleep, or lack of exercise when the real problem may actually be overcorrected blood pressure. This is why so many cardiologists are now encouraging seniors to pay attention not only to numbers but also to how their body feels every day. The body often sends clear signals when circulation is becoming too low, but those signals are easy to ignore until they begin affecting safety, mobility, and quality of life. One of the most common symptoms is dizziness, especially when standing up quickly. A person may rise from bed, a chair, or the bathroom and suddenly feel lightheaded for a few seconds. Some describe it as a spinning sensation, while others feel like they might faint. This happens because blood pressure drops too quickly and the brain temporarily receives less blood flow. In younger people, the body usually corrects this rapidly, but after 60, those adjustments may happen more slowly. Over time, this increases the risk of falls, which are one of the leading causes of serious injury among older adults. Another major warning sign is constant fatigue. Many seniors with overly aggressive blood pressure treatment report feeling drained even after sleeping well. They may lose motivation to walk, exercise, socialize, or complete simple daily tasks. Some experience brain fog, slower thinking, memory lapses, or difficulty concentrating because the brain is not receiving steady circulation throughout the day. Others notice blurry vision, weakness in the legs, cold hands and feet, or shortness of breath during light activity. These symptoms are sometimes subtle at first, but they can gradually reduce confidence and independence. Balance problems are another important clue. A person may feel unstable while walking or become nervous about climbing stairs. Family members sometimes notice that their loved one moves more cautiously or avoids activities they once enjoyed. In many cases, these changes are blamed on aging alone, when blood pressure medications may actually be contributing to the problem. Dehydration can make these symptoms even worse, especially during hot weather, illness, or poor appetite. Modern cardiologists increasingly emphasize that treatment should improve life, not make daily living harder. Blood pressure management is meant to protect the heart and brain, but if treatment leaves someone exhausted, dizzy, weak, or fearful of falling, the approach may need adjustment. The healthiest blood pressure is not simply the lowest reading possible, but the range that allows the body and mind to function safely, clearly, and confidently while still reducing long-term cardiovascular risk and preserving independence for years to come. Protecting your heart after 60 is no longer just about forcing your blood pressure to the lowest possible number. Modern cardiologists are increasingly focused on helping older adults maintain a balance between heart protection and overall physical well-being. The goal is not simply to survive longer, but to remain energetic, mentally sharp, steady on your feet, and independent for as many years as possible. That means managing blood pressure in a way that supports the entire body rather than creating new problems through overly aggressive treatment. Many seniors are now discovering that sustainable daily habits often matter just as much as medication when it comes to maintaining healthy circulation safely. One of the most powerful ways to support healthy blood pressure naturally is regular movement. Walking, light strength exercises, stretching, and staying physically active help blood vessels remain flexible and improve circulation throughout the body. Even short daily walks can support heart health, reduce stiffness, improve balance, and help stabilize blood pressure over time. Physical activity also strengthens muscles that protect older adults from falls and mobility problems. The key is consistency rather than intensity. Gentle daily movement is often far more beneficial than extreme exercise done occasionally. Hydration is another factor many people underestimate. As we age, the sense of thirst becomes weaker, and many seniors unintentionally become mildly dehydrated. This can cause blood pressure to fluctuate dramatically and increase dizziness, weakness, and fatigue. Drinking enough fluids throughout the day helps maintain stable circulation and reduces the risk of sudden pressure drops. Proper nutrition matters as well. Diets rich in vegetables, fruits, lean proteins, healthy fats, and potassium-containing foods can support blood vessel health while reducing strain on the heart. Excess salt, processed foods, smoking, and heavy alcohol use can all worsen blood pressure instability over time. Sleep and stress management also play a major role. Poor sleep raises stress hormones and can increase both blood pressure and inflammation inside the body. Chronic stress keeps the nervous system in a constant state of tension, forcing the heart to work harder throughout the day. Relaxation techniques, social connection, regular sleep schedules, and mental stimulation can all contribute to healthier cardiovascular function as people age. Most importantly, older adults should never adjust medications on their own, but should regularly discuss symptoms and blood pressure readings with their doctor. If dizziness, weakness, confusion, or balance problems develop, those symptoms deserve attention even if blood pressure numbers appear perfect. True heart health after 60 is not about chasing unrealistic perfection. It is about finding a stable, safe range that protects the heart while allowing the brain, muscles, kidneys, and entire body to function comfortably, confidently, and independently through every stage of aging. As we've explored throughout this discussion, the biggest lesson is that blood pressure after 60 is no longer about chasing a single perfect number. For decades, people believed that 120/80 was the ultimate goal for everyone, regardless of age, strength, lifestyle, or medical condition. But modern cardiology is teaching us something far more important. The safest blood pressure is the one that protects both your heart and your quality of life at the same time. Lower is not always better, especially if lower leaves you dizzy, exhausted, weak, mentally foggy, or at risk of falling. The body changes with age. Ori stiffens, circulation patterns shift, and older adults often need a more personalized approach to maintain maintain healthy blood flow to the brain, kidneys, muscles, and other vital organs. That is why many cardiologists are now focusing less on perfection and more on balance, stability, and how patients actually feel in daily life. This does not mean ignoring high blood pressure or avoiding treatment. High blood pressure remains one of the leading causes of stroke, heart disease, kidney damage, and premature death. But treatment should support long-term health without sacrificing independence, mobility, energy, and mental clarity. A healthy blood pressure plan after 60 should help you live better, not simply produce impressive numbers on a chart. The most important thing you can do is work closely with your doctor, monitor symptoms carefully, stay physically active, eat well, remain hydrated, manage stress, and pay attention to how your body responds to treatment. If you feel constantly tired, dizzy, unstable, or mentally slowed down, those signs matter. Your body is communicating something important, and those symptoms should never be ignored simply because your readings appear normal. True healthy aging is not about trying to force your body to behave like it did at 30 years old. It is about understanding what your body needs now and making smart adjustments that protect both longevity and daily function. The healthiest older adults are often not the ones with the lowest blood pressure readings, but the ones who can still walk confidently, think clearly, stay independent, and enjoy life without fear or physical limitation. Because after 60, the goal is not simply to add years to your life, it is to add strength, stability, confidence, and quality to the years you already have.